Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. I'm sorry for the delay. I think we had camera issues, but we're ready to go now, and I wanted to introduce Dr. Bonnie Henry.
Thank you. Good afternoon. For our today's update on the COVID-19 situation here in British Columbia, I'm going to be talking about the two time periods, so the 24 hours from Saturday to Sunday and then April 5th to today. So from Saturday to Sunday, we had 26 new cases test positive for COVID-19 here in British Columbia. And then for today, we have an additional 37. So that is 63 over the last 2 days to bring us up to 1,266 people in British Columbia who have tested positive for COVID-19. That includes 586 in the Vancouver Coastal Health Region, 450 in the Fraser Health Region, 79 on Vancouver Island, 128 in Interior Health, and 23 in the Northern Health Region. In addition, we now have 210 cases who are associated with long-term care or assisted living. All of them have been in the Fraser or Vancouver Coastal Health Region. So we now have 21 active outbreaks in those regions, three of the previous ones have been declared over, which means there have been no cases for 2 incubation periods. So that's good news around that. Currently in our case status, there are 140 people hospitalized across British Columbia right now, and 72 of those are people in critical care in ICU or in the high acuity units. We've had one additional death in the last 2 days, and that is a community death in a known COVID positive case, a man in his 40s, and the coroner's service, as with all sudden unexpected deaths in the community, is investigating. We have had 783 people who tested positive who have fully recovered. I do want to also say that we've had community outbreaks, as you know, in a couple of different situations, and we've been advised of another outbreak in a correctional facility, this time a federal correctional facility in Mission, where there's, as I understand it, 2 positive inmates in that facility, and an ongoing investigation and outbreak response is actively activated there. This, as we've been saying, this is in the middle of our critical weeks here for COVID-19, and we must be steadfast in our commitment to holding the line right now in BC. We continue to see clusters and outbreaks in our communities and at facilities, and these hotspots are very concerning. They can quickly escalate and challenge our response, our ability to keep things under control. Our percentage of new cases, as you can see, has been slowing. It's been bending, and that's really important, and it's testament to the effort that everybody here in British Columbia has been making over these past few weeks. But we must keep that firewall strong. My focus this week is to be supporting you all in making sure that we are doing what we're doing that's making a difference. And you need to continue as well to focus on everything possible to break those chains of transmission in our communities across British Columbia. We've talked about travelers coming home, and it is important for us all to welcome them travelers home, but make sure they have the means to join us in this and do their part by following the orders of self-isolation for 14 days after they come back here. We understand the many sacrifices that are being made across the province right now to ensure that we do our best and everything we can to protect our families, our communities, our healthcare workers, and our healthcare system. I also know that it's been challenging for many people, and I want to really encourage us all to continue to be kind with those who have to continue to work, whether it's in the grocery store, whether it's healthcare workers, people working in pharmacies. I know sometimes it's challenging when we've been going through this whole isolation and not having the usual contact and the usual things that we need to do. I think it's important as well for us to recognize that we can have anxiety, and there be anxiety that is being expressed by our children, by our family members. I encourage people to talk to your physician if you have one. They can talk to you through virtual care. They can support you, and particularly if you're somebody who has an underlying illness and needs to have that ongoing care, they are the best people who can support you in that. I also would recommend that people think about ways that we can support each other in reducing anxiety. And I know there's a couple of websites, for example, here in BC that are really helpful, including Anxiety Canada, where there's some really great information that you can think about how you're dealing with COVID-19, and also for young people and people in your life to support them as well. The other one that I know is Bounce Back BC, also a very helpful website to get resources to support yourself and your family. So we need to redouble our efforts. We need to keep this up. We need to continue to work to stay home and to do our part, but to support and care for those around us at a distance. And I'll say again, this is our time to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry, and I wanted to start by saying, expressing my condolences, the condolences of everyone involved, to the family of the person who died today. No day where anyone passes away from COVID-19 is a good day. And while we reflect on different numbers here, we want to acknowledge the loss that people must be feeling today, the community of friends, the community of coworkers, and we wanted to express our deep sympathies for their loss. As Dr. Henry has said, we have 140 people hospitalized with COVID-19 in British Columbia. That's slightly above Sunday when it was 137, and slightly below Saturday when it was 149. 63 of those are in Fraser Health, 49 in Vancouver Coastal Health, 13 in Interior Health, 11 in Island Health, and 4 in the Northern Health Authority. We have, as of today, 4,422 beds that are empty in BC, and so our occupancy rate in our acute care hospitals is 58.8%. Our occupancy rate in our critical care units is 53.3%. There were 6,559 emergency cases on March 9th. There were 2,995 on April the 5th. And obviously, we know the efforts that are being made right now, especially by healthcare workers in all sectors, in long-term care, in home support, ambulance paramedics, people, especially in our acute care hospitals right now, to both support people dealing with respiratory illness, dealing with COVID-19, and also to prepare for the potential of more difficult days ahead. I want to bring a few updates. First of all, with respect to personal protective equipment, we're continuing to work hard in what is a tough supply market to obtain PPE. Since my last update on Friday, we've received a small supply from the federal government, and we've also received a significant number of surgical masks and N95 respirators that are undergoing assessment and testing right now. As the masks are not from our traditional suppliers, we need to make sure they are safe and effective before putting them into circulation with healthcare workers. With respect to ventilators, I wanted to say that at our March 27th briefing on epi modeling and the healthcare capacity, I told you that we had 457 adult critical care ventilators in our inventory, of which 348 were already available at our large COVID sites. I'm happy to say that just over a week later, with all the additions we've had, we now have 620 adult capable critical care ventilators already distributed throughout our large hospital. We also have 33 of our newly purchased critical ventilators ready to go, plus 55 new ventilators that just arrived this morning from the National Emergency Supply that we're in the process of reviewing and testing for usability. As Dr. Henry has said, it's absolutely important right now, critical, that everyone comply 100% with her orders and with the orders of the federal government under the Quarantine Act. In particular, that means people returning to British Columbia, returning to Canada from abroad. We understand that many Canadians are going to be diligent and careful to observe the rules, but there will be cases where lack of information or lack of resources or both make it difficult to self-isolate. So we're continuing to work with the Government of Canada to improve protections for all Canadians. It makes sense for every single person to have a plan in place with no exceptions. If there are gaps in the plan that some can't fill in on their own, they need support to close those gaps. And where they can't or don't or won't plan or follow a plan, there must be enforcement without exceptions. We think we're being heard on this point and hope we can announce soon joint measures with Canada to make sure the federal program becomes not just an announcement but reality and provides concrete protection as soon as possible. I wanted to note on a more positive note and express our appreciation, Dr. Henry's, the Premier's, my own, to an organization that's of volunteers that does what's called the Sikh Blood Drive every year. People in the South Asian community of the Sikh faith who every year launch one of the biggest blood drives in Canada. They are launching a new blood drive at the call of Dr. Henry and many others across the country, and we're so honored and excited by that. They're working with Canadian Blood Services on that, and it's such an important thing to do and really heartening to see they and so many other people in the community supporting one another at this critical time. So I just want to say finally, that's an example. We have to be 100% all in. We say it on a regular basis, but we have to follow it now. There has been some flattening of the curve in some areas, as we've seen, but that is because of the efforts of everyone in BC, and we simply cannot let up now. As Dr. Henry has said, these are key weeks for us. This is a key week for us, especially leading into the long weekend next weekend. I want to make a special request to all of those celebrating all of the religious holidays of the season, from Ramadan to Passover to Vaisakhi to Easter, that this is not the time. This is not the time to come together in groups to celebrate, but to recognize these important moments of faith in new ways, virtually, in order to both satisfy the demands of religious faith, but also to ensure that everyone is kept safe in these times. Aujourd'hui, nous fournissons une mise à jour des cas pour deux périodes de rapport de 24 heures, soit de 4 au 5 avril et de 5 avril à midi d'aujourd'hui. Au cours de la première période de rapport jusqu'au 5 avril, nous avons eu 26 nouveaux cas pour un total de 1229 cas en Colombie-Britannique. Au cours des dernières 24 heures, nous avons eu 37 nouveaux cas pour un total de 1266 cas en Colombie-Britannique. Cela représente 63 nouveaux cas depuis que nous sommes notre mise à jour samedi. Il y a, bien sûr, 39 décès maintenant liés au COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer que nous avons eu un deuxième décès dans la communauté et nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Thank you very much, and we're happy to take your questions.
Thank you. So before we move into the question, as a reminder, please press *1 to enter the queue. You are limited to one question. And please unmute your phones. You're not audible until we call your name. First question this afternoon is from Ian Bailey with the Globe and Mail. Go ahead.
A question for Dr. Henry. Dr. Henry, what are your views on whether families should remove seniors from long-term care facilities, given the manner that COVID-19 has been a concern in them? And what advice and cautions would you offer to families who decide to take this step or consider this step?
Yeah, I know it's a very difficult and challenging thought for people, and for many families it's not an option. Their loved one needs the care that they receive in a long-term care facility. So our focus has been on doing everything we can to make long-term care facilities as safe as possible, to try and reduce the possibilities of introduction into long-term care, and having that very low threshold for responding immediately should we have any concerns about illness and the outbreak protocols. So I think that right now is not the time to disrupt people's lives in that way, and for many people it's not an option, and the focus we all need to have is on doing everything we can to protect our vulnerable seniors and elders, particularly in long-term care.
Next up is Shannon Patterson, CTV.
Oh, hi, Dr. Henry. This morning, Dr. Theresa Tam made a recommendation for non-medical face covering. She says it's the sensible thing to do. She's saying that it's a bit like covering your cough. Use it when you're on the bus or in a grocery store. You have in the past not recommended this, but she said this was coming at the recommendation of all provincial health officers that was decided yesterday. Were you part of this decision, and do you have any concerns that it would make people sort of back off social distancing or cause any other issues?
Yeah, so I think absolutely I was part of the decision. We have a special advisory committee, and we've been reviewing evidence from around the world around when people are able to transmit this virus. So we did come up, it's not a recommendation. It is a permissive use, if you will, and for exactly the reasons that you say. This virus can't jump 6 feet. So when you're outside, maintaining physical distance are things we know works, and we've seen that here in BC. So there are proven things we know that prevent transmission of this virus. Cleaning your hands regularly, covering your mouth when you cough, not touching your face and eyes, and maintaining that safe distance from people. Wear a non-medical mask, and I can't emphasize that enough, and we've talked about that here. Medical masks and respirators need to be reserved for our healthcare settings and our healthcare workers, because that's where they do the most good. But a handmade cloth face covering that we've seen people using in other places, for short term, they can protect others around you from your droplets. So it's not going to protect you from getting infected with this virus. But for short term, it is a similar analogy to coughing into your sleeve or coughing into a tissue. It may keep your droplets in so that they're not in the air or in the on surfaces around you. It's not an alternative to the things that we know work, but in those places where you might not be able to maintain the physical distance for the whole time, like transportation, for example, or if you have to go out to the grocery store, it is an option for people. I think we need to be very careful not to say that it's required or recommended for everybody, but it is an option, particularly if you're not sure that you're going to be able to cover your cough if you need to.
Lisa Yusta?
Hi there. Looking, Dr. Henry, at case numbers, and we know that you keep saying very clearly that it's the test positive cases that we're hearing about. Are the numbers of people who are, let's say, coming from other countries or who are being ill at home, how are we accounting for those number of cases? And is there also being an accounting for how different socioeconomic groups are being affected?
That's a really good question. We are not counting those cases that we don't know about, so people who are coming from other countries and have mild illness and are self-isolating at home. We have no way of counting those, and how we will know a broader sense of who has actually been infected in our community is when we have a serology test that allows us to tell who has antibodies, and that's the one that will let us know who in the community has been affected. Our focus of the testing, as you know, is on people where we think they might end up in hospital. It'll change either our public health management or our individual health care management. So we're focusing on long-term care homes, on clusters and outbreaks in the community. Some of those clusters do include people who are a close family member of somebody who's tested positive, and we call those epi-linked cases. So we are accounting for those cases. In terms of how it's affecting people in different socioeconomic strata, that is something that we are monitoring. I don't have the data yet. We're looking at it in a variety of different ways, and it's really part of an initiative that we're working on to understand all of the unintended consequences of what we're doing and the measures that we're doing in our community and how they impact different people, not only the disease, but the effects of the social distancing that we're doing and the economic effects and how those affect different people. So those are things that are ongoing in terms of trying to monitor that and to quantify that over time.
Next, we have Jeff Andreas from Radio NL. Go ahead.
Hi, Dr. Henry. You have told us in the past, just how many workers working in like long-term care homes have been infected with COVID-19. But have you been keeping track of those, nurses and doctors working on the front lines that have received a positive diagnosis? Nurses and doctors who would typically be ready to work in a hospital setting and provide care. Like, do you know how many have been taken out of service while they recover at home, and how difficult is that making things for those who are continuing to work in terms of having, maybe longer hours or more patients to take care of? Like, how worried are you about employee burnout and just how many people are in fact coming down with COVID-19 who are working in those emergency care facilities?
Yeah, so the vast majority of the healthcare workers who have been affected have been people who are working in long-term care, and that's where a lot of the challenges have been in a variety of different healthcare workers in the long-term care setting in particular. We have not had a lot of people in our hospital system be affected by COVID-19 yet, so we're not seeing that. There has been some, and I don't have the numbers. We don't actually break it down by where people are working, and in some cases it's healthcare workers who are infected through travel or through attending things like conferences that we know have affected a number of healthcare workers. So I don't have that data broken down. It's not been an issue that I'm aware of in our acute care hospitals or the intensive care units or the hospital wards that are caring for people with COVID-19 at the moment. But again, that is because we have been doing such a good job here of trying to keep this in a manageable way. So I am heartened, and we also don't have issues yet with PPE, so people are able to be well protected when they're working in our hospital system so far.
Tanya Fletcher, CBC.
Hi, Doctor. Can you expand on why it appears early on that BC's curve might be flattening while other provinces, especially out east, have been seeing accelerations, especially that in general terms we seem to take similar measures around the same time?
Yeah, I know, and it's very hard to know exactly why. We took a lot of measures quite early. I will say that we took the measures. We were at a lot of the work that we did early on in this. We were one of the first provinces to have cases here, and we spent a lot of time, as you know, doing wide testing, putting out those sparks which were related to people coming in from other countries and bringing this disease with them. And some parts of it are luck, and some parts of it are being prepared, but we were able, I believe, to not have a lot of community spread before we recognized that we had some community transmission and put on the very restrictive measures just prior to our March break. And I think that's a critical thing as well. And part of that is because we learned from Quebec, and my colleagues in Quebec were reporting to us that their March break was 2 weeks earlier than ours, and people were coming back. They have very strong connections, as we know, with countries like France, and people were coming home from March break and getting sick. And so I think, we put the measures on around the same time, but they had a lot more community spread, so they were still catching up. And I believe that's a similar situation in Ontario from what we look at. So part of it was, the system that we had in place to detect cases in our communities here, and part of it was luck, and part of it was timing, I believe.
Next is Vaughn Palmer, Vancouver Sun.
Minister Dix, Wednesday, Thursday, and Friday of last week, you listed off some expectations that the province has of the federal government regarding Canadians returning from overseas and from outside the country. And some of the things you said you wanted to see was a stronger presence at the airport with arrivals in both Vancouver International and Kelowna Airport. You said that there needed to be communicated more clearly, that there should be no exceptions to the quarantine rule. You said the provincial government, the health ministry, needs more information, full information about the people arriving, and you said we need more quarantine space for people who need to be quarantined. I'm wondering, do you feel you've made any progress on all of that, and do you still have concerns, and where are they?
Yes and yes. Yes, I think we've made progress working with the federal government, and in the work that we're doing has involved everyone, the leadership of the Premier, the leadership by the whole government, at the Deputy Minister level, by Dr. Henry and everyone else. So I think we're making progress, and I think they're hearing us, and we're going to work with them to see that change happens. Because remember, it's a variety of sources. There's people coming home via the land borders, and that's important. And every single one of them has to have a plan to self-isolate for 14 days, every one. There's people coming in at YVR, both from international flights, and I think I checked Friday, I think there are 9 or so flights from Seattle, from San Francisco, from Los Angeles, including flights that go to Kelowna and Victoria. So all of that requires everybody to have a plan, and for us, one, to be able to support people in that, should they require such support. But everyone has to self-isolate for 14 days. That's the rule under the Quarantine Act. And it's not just the letter of the law. The letter of the law has to be felt in practice. So I think the federal government has heard us on that, and we're working with them. And I'm hopeful that we're going to be able to let everyone know about that progress very soon.
Next question is from Marcella Bernardo, News 1130.
Hi there. I was hoping to ask the question about the situation regarding lots of groups now offering to source medical supplies, but how do we know that these people aren't scammers and that the supplies they're rounding up are actually safe?
A very good question. I know myself, the minister, get inundated with these. So we actually have a little team, a bigger team now, but a team at the Ministry of Health that is focusing on that exactly. And you can actually, we've now got a website called...
There's a hub there. You
hub.
can get it through the COVID-19 website.
Yeah, the COVID-19 website, there's a hub, a safe hub that you can put in your offerings, and it gets assessed. And so we have been able to weed out a number of them and actually connect with a number of people who've had some very good ideas and some very good supports that we can use. So there is a team that is validating all of these and also assessing the products for safety, as we mentioned, particularly when there's products that are coming in that aren't from our usual suppliers.
Richard Sussman, Global News. Richard?
I'm here. Can you hear me okay?
Yes.
Dr. Henry or Minister Dix, I'm not sure if there have been any concerns similar to Ontario yet in terms of British Columbia being able to get PPEs from the United States. And also on that, what stage in terms of the pandemic framework are we at in regards to the government's policy on how to prioritize the use of PPEs in the healthcare system?
Yeah, so we're at, in that document, we're at phase 4. That's what we're using in terms of how we are prioritizing, cohorting, and using of PPE in the healthcare system. We don't have any supplies that I'm aware of that have been affected yet by the concerns from the U.S. We are sourcing supplies from many different places around the world, including in partnership with the federal government.
Next question comes from Justine Hunter, Global Mail.
Hi, thanks. And I'm actually also asking about PPEs. I'm wondering if you can tell us how many days' worth of supply do we currently have, and what share of the supply that we have received is from Ottawa versus other sources?
You can tell.
Well, we certainly feel good as to supply, but we've put in place, as Dr. Henry has said, measures to ensure that we're using PPE properly so that we extend current supply. As I've mentioned, we've received some supply from the federal government. We've had much discussion with them about the distribution of that supply, and they're very confident in their efforts to deliver more, and we're very appreciative of those efforts and our joint efforts together in that. In addition, we've had some success ourselves. So I can't give you the precise numbers of how many we've received from different sources. We're not we're not talking as much about the sources of supply and the sources of contribution right now, although there will certainly be a full accounting for all that at a later date. But what we are saying is that we need to continue to have the measures we're taking, and we had some success, both, as you can see from the report today, on ventilators, and some success this past weekend with respect to PPE. But we have to keep working on that, and we're hopeful that if we can get through these next couple of weeks, which are important weeks, that supply, the world supply, will become better for us. And certainly we have optimistic signs from Ottawa that there's supply coming from there as well. So our efforts have had some success recently, as have Ottawa's, and we're hoping for more.
Okay, we have time for a couple more questions. Next up is Kat Slepian from the Black Press. Go ahead, please.
Hi there. I wanted to ask about the new death in terms of this community. Does that mean that this individual passed away at home? And is there any concern in terms of deaths or cases among younger people in their 40s, 30s, 20s, that sort of thing?
Yeah, so yes, unfortunately, this person did pass away at home. And was a known positive case, so that's doubly tragic for us. And it was a man in his 40s, so we are, of course, concerned about the effects that this virus can have even on young people. We know that there's been some young people in other parts of the country, including someone in their 20s who's unfortunately died in Alberta over the last few days. So it is, young people are not immune to this. Most of the people who have unfortunately died here in British Columbia are people from the long-term care home. So they have been mostly over, with the one exception of a person in their 60s. Everybody else has been in their 70s or older. So it is tragic at any point in one's life, but it does go to show us that even younger people are not immune to the serious effects of COVID-19.
Okay, before we get to our last question, for any reporters that didn't get to ask a question today, there will be a statement released this afternoon with all of the information in it. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Our last question today is from Dominique Lévesque, CBC Radio Canada. Go ahead.
Oui, bonjour. Do you hear me?
Yes.
OK. C'est pour le ministre Adrian. Pourriez-vous nous dire en français, est-ce que ça touche les plus jeunes, ce virus?
Excusez-moi, pouvez-vous la répéter?
Je voudrais savoir comment est-ce que ça touche les plus jeunes. Comment, il y a eu beaucoup de décès de personnes âgées, mais est-ce que ça touche aussi les plus jeunes?
Effectivement, aujourd'hui, la personne qui a été morte pendant le week-end, c'est une personne d'une quarantaine d'années, un homme d'une quarantaine d'années, et cela démontre que bien que la grande majorité des cas soient des personnes de troisième âge, de 70 ans ou plus, quand même cela a un effet important peut avoir un effet important sur les jeunes, donc c'est important. Il y avait quelqu'un qui a été mort en Alberta il y a quelques jours, qui a eu une vingtaine d'années aussi. Donc, cela démontre que ce n'est pas seulement les personnes âgées qui sont vulnérables, mais beaucoup plus de monde, surtout des gens qui ont des maladies chroniques, disons, qui sont bien sûr vulnérables en général et qui sont vulnérables bien sûr au COVID-19. Donc, c'est la grande majorité des gens qui sont morts, qui sont décédés de COVID-19 sont quand même des personnes de troisième âge, mais cela a une influence sur tout le monde et il faut que tout le monde prenne garde, que tout le monde fait des mesures à 100% qui étaient désignées par le Dr Henry et qu'ils le font quotidiennement. Merci beaucoup. Thank you very much.
Thank you.